Hi, Kate. Welcome.
Hi,
I'm Tia Savage. It's so nice to meet you.
it's nice to meet you.
I use she, her pronouns. Which ones do you use?
I use she, her too. Thank you for asking.
Yeah, for sure. Well, welcome to my office. Welcome to Baird. I always like to let people know that anything in here is for you to touch, explore, fidget with. I know sometimes people really appreciate having a fidget in their hand. You may notice behind you, I have some crystals. You're welcome to use those as well.
That's cool.
I have a sound machine outside of the door, so it, really muffles what's going on in here. Unfortunately, the walls are thin, but we all try to really respect confidentiality while we're in here. Were you able to take a look at the notice of privacy practices and student rights?
I did, yeah.
Yeah. Did you have any questions or concerns about that?
No, I don't think so. I just, I hope everything's private and, it's important, I think.
Yeah, so let me tell you a little bit about how confidentiality works. Are you familiar with that term and kind of what that means for a counseling type setting?
Oh, well, I know what the word means, maybe not exactly when I'm here at Baird, so,
Sure.
yeah, we're in a very small school, right?
Yeah. So let me tell you a little bit about that. So here, well, in therapy in general, confidentiality means that anything that you and I talk about is between you and I. There is no need for me to be talking about you or what you talk about to anybody else. The only time that I would ever break confidentiality, and I would let you know, is if you have a plan to hurt yourself and we need to get you support, or if you have a plan to hurt somebody else, then it's my due diligence to warn them. I would never act on any of that without giving you a heads up first. And then within these walls, we have group supervision where we will consult on clients, and we try our best to maybe not use names, not use identifying factors, but it's usually for the purpose of learning.
Mhm.
So that's kind of what confidentiality means here. What's said in this room stays in this room, and there's no need to talk about it anywhere else with anyone on campus.
Oh, okay. So can I ask a question?
Sure.
So how does it work? Like, so my friend sees you too, and and that's a big part of the reason I'm here.
Yeah.
And can you talk about, like, I'm a little worried. How does that work when you see two best friends who are, having a whole lot of problems right now?
Yeah. So I'm hearing that you're having some concerns about the fact that I also meet with your friend, and how is that gonna pan out? How are we gonna be able to protect confidentiality of both you and your friend?
Yeah.
Yeah. It is. It's a small campus, and unfortunately people overlap, and I gotta be honest with you, you and your friend are not the first pair or group that I've seen here. I do have quite a few students on campus that are all within a group, and sometimes students will come and they'll talk to me about their friends, sometimes some not so great stuff, some things that are really stressing them out, and I put on my poker face. Like, I don't know who you're talking about. I can't confirm nor deny that I see your friend. You could tell me your friend's name and I don't know. Just like if your friend came in here and was like, oh, well, I know Kate saw you yesterday and she must have, I'd be like, I don't know. So I really try to make it clear that, you and a best friend, or you and a roommate, or you and a partner could both come see me, and you're separate people. Now, in private practice, that's a little bit different, kind of dual relationship type things, or having to worry about that. But here at Colby Sawyer, that's just the nature of the beast. It's a small campus. There's 4 counselors. I can let you know that if you ever felt uncomfortable with me, I could introduce you to another counselor. But I really make sure that confidentiality is kept nice and tight.
Okay, that's good, because I've heard you're really nice, and you're really good at this. So yeah, it just sounds hard to have friends and have to not say anything.
Yeah, it's hard. It's hard. And, not to throw myself under the bus age-wise, but I've been doing this for 20 years. So I think, I've really been able to navigate when that happens. And we talk it through. And I've had friends come in here and say, "You're not going to tell my friend that I was just bad mouthing them." And I'm like, no, this is a safe place. I really want this office to be a place where you can come and you can say anything. You can, I call it verbal diarrhea of the mouth. If you need to just get it out, if you need to bitch about something, if you want to problem solve, this is your time. This is for you to be here.
Okay. Okay, that sounds good.
Does that feel good?
That sounds good. Yeah, yeah, that's good. That's good to know. I was a little worried about it.
Yeah, understandable. It can be a little worrisome starting therapy or, in a new environment with new people. Have you ever been in therapy before coming here to Baird?
Um, well, my parents got divorced when I was about 10. They split up when I was 9, but they got divorced. So they sent me to a counselor then, but I didn't really like them that much. They weren't very nice. And so,
Yeah.
it didn't seem to do much, but my parents wanted me to go. So I went for a little bit.
Yeah.
Yeah.
So you saw a counselor when you were 10, long time ago, right?
Yeah.
Half of your life, maybe.
Yeah.
And it just, you didn't get the warm and fuzzies. It just didn't really help.
There weren't fidget toys,
Oh.
it felt more like a doctor's office, I guess. And so it just didn't seem to be helpful for me then. But
Yeah. So the space didn't really feel comforting to you, and maybe there was not enough supports within your environment that would have helped facilitate some conversation.
Yeah,
Yeah.
I think so.
Yeah. So it's been a while since you've been in therapy, and obviously therapy from being a 10-year-old to being a 20-year-old is very different. What brings you here today?
Well, it's my best friend, and so can I say her name?
Sure can.
So it's my friend Amy, and she's. I feel like we've been friends since freshman year. We both got here and we met at orientation, and so we've been roommates, and we do everything together except she's on the tennis team, so that's a little different thing, but other than that we're really close. And she started doing some things that are really worrying to me, in like her eating and her not eating for a long sort of stretch of time, like she'll go the whole day, and she just seems really pretty obsessed with the way that she looks, and it's I'm just really worried about her. And she's a nursing student. She was getting all A's, and now she's starting to need help on things and not turn in assignments, and I don't know what to do. I don't know what to do because she's kind of making me keep this as much of a secret as possible. Like she doesn't come out and say this needs to be a secret, but I feel like that she's not nearly as healthy as she used to be, and I don't know what to do about it. And I feel like I'm one of the only people who really know how unhealthy her behavior has gotten over the last, just this year, since September, and we came back from break, and she's really, she doesn't look like herself. She doesn't act like herself.
So you're really worried about your friend. You've been friends with her for a while now, and it sounds like maybe she has some form of an eating disorder that she's confiding you about, but she really doesn't want other people to know. And so here you are left holding this secret and wanting to help your friend, and